torch infections. These are nothing but the definition. The infections that are transmitted from the mother to the fetus. Other important point to note is the expansion of torch. T is for toxoplasma gondii. R is for rubella. C is for the cytomegalovirus. V. Next comes the H. It is the HIV. Next, herpes simplex virus. And S is for syphilis. Looking at important points to know, in case of the toxoplasma gondii, keywords to know is it is from cat feces or ingestion of undercooked meat. Next, in cases of the neonate, the important manifestation is a triad. It includes chorioretinitis, hydrocephalus, and intracranial calcification. Next is looking at rubella. Rubella, it is by the respiratory droplets. There is presence of polyarthritis, polyarthralgia, and in case of the neonatal manifestations, there is a triad. This includes abnormalities of the eye and ear, that is, you can call it cataract or deafness. There is presence of congenital heart diseases like the PDA, and there is blueberry muffin rash that can be seen. Next is the cytomegalovirus. It is from the sexual route, sexual contact, or in case of the organ transplant. It is mainly asymptomatic, and in case of the neonates, is presence of blueberry muffin rash. You can Google the image. Next is HIV. It is again by sexual contact or needle stick. And the main important factor is the CD4 count plays a role in the manifestation of the symptoms, and in neonatal manifestations there is diarrhea and recurrent infections. Next, looking at the next disorder, that is HSV2. There's herpes simplex virus 2, and it is in the skin and mucous membrane contact. It's usually asymptomatic and there is herpetic lesions. In cases of the neonatal manifestations, there is meningoencephalitis and herpetic lesions. Next, syphilis. It is by the sexual contact. The neonatal manifestations include stillbirth, hydrocephalus, and facial abnormalities. That includes notched teeth, saddle nose, short maxilla, as well as the cranial nerve 8, deafness.